Hello, ladies. Today we are talking all about magnesium. And so this was a mini webinar, however you want to call it, that I've been wanting to do for quite some time because I see so many people discussing magnesium online. And I discuss it a lot with my patients as well, but it's super interesting because some of the research doesn't really support, or let's say it's a little bit muddy. So without further ado, let's get started and talk about, if you're taking magnesium and you still can't sleep, what is happening? All right. So what is magnesium anyway? It's actually a mineral that your body needs for a lot of its functions, including things like your muscles, your nerves, your blood sugar, and even your blood pressure. And the thing about magnesium is that it's stored inside of our cells. Some of the studies show like 99% of our magnesium is stored. So if you do like a regular blood test just to see what's going on with your magnesium level, it may show up normal, but that doesn't necessarily mean that you could be deficient in magnesium. So about 2/3 of our magnesium inside our body is in our bone, and about a third is in our cell. And only less than 1% of our total magnesium is extracellular, I mean outside of the cells inside of our body. So with that said, if you check the serum level of magnesium, it doesn't actually reflect too much of your intracellular. And some doctors who know about this, or medical professionals, check the red blood cell magnesium level. With that said, a lot of us get magnesium from our diet, the things that we eat, and optimal magnesium is considered for women about 320 milligrams. And ways that you can get it are through like green leafy vegetables, whole grains, nuts, and legumes. So plant-based diet is certainly helpful, or plant-forward. There are certain factors that may contribute to magnesium deficiency. If you're older, depending on the type of food that you're eating, that can impact it. If you have, GI issues, depending on where magnesium is absorbed, that can impact it. Having type 2 diabetes, sometimes even certain medications can impact magnesium absorption. Having alcohol use has also been associated, alcohol use disorder. So alcoholism, probably with people who chronically drink alcohol, that can impact your magnesium levels as well. So what is the deal with magnesium and sleep? Well, this one is pretty interesting. Some things I, have read about before, but sort of diving deeper, magnesium helps influence our sleep because it regulates that GABA system. So the GABA system is a neurotransmitter, and magnesium can actually connect or bind to these GABA receptors because GABA helps us fall asleep, or helps us feel calm, reduce excitability, can help with sort of an anxiolytic. If we're a little bit anxious, it can help with that. Magnesium can also interact, or I know block, the NMDA receptor, which helps promote muscle relaxation by lowering calcium inside the cells. So for our patients who have restless leg syndrome, maybe muscle cramps, that one was sort of like plus minus in terms of research, but maybe helps with that. Studies in rats, and I think a couple studies in humans, show that magnesium, if you have a deficiency in magnesium, it can reduce your plasma melatonin levels, which is really interesting because melatonin is a hormone that helps support our sleep stages. Yeah. And then also magnesium supplementation. So taking extra magnesium may help lower cortisol. So which is really cool. Not enough magnesium, poor melatonin. And then taking magnesium can help lower cortisol, which is a stress hormone. It does more than that, but it can help relax us and soothe our central nervous system, potentially even improving our sleep quality. So 4 different things that magnesium can do to help someone who has difficulty sleeping. Is it a cure-all? Certainly not. I see sometimes people post, if I'm taking this much magnesium, should I take more and more and more? I've seen some people actually take too much magnesium, which is, something to be cautious of. More is not necessarily better. Some things that are associated with too much magnesium toxicity, are low blood pressure, hypotension, nausea, vomiting, facial flushing, retention of urine. It can slow down your GI symptoms, depression, feeling super, super tired, even muscle weakness, difficulty breathing, extreme low blood pressure, regular heartbeat, and not good things. So more is not better. If you're taking, what the bottle recommends for magnesium and it's not working, just stop, to be honest. And because there may be something else going on with your sleep, right? it's definitely not a cure all, right? It's used to supplement maybe some of the symptoms you're having. But as always, if you're going to start a new medication or supplement, talk to your licensed healthcare provider in your area to see if it's a good fit for you. So let's talk about some of the specific studies, right? Because that's sort of how we know if something is working or not. Ideally, we'd have, double-blind, placebo, randomized controlled trials, which, we don't always have. Maybe there's a couple of randomized controlled trials, but it's a little bit more challenging to do when we have a supplement because guess what? They are not sponsored by big companies. And so there's not always a lot of funding to do these kind of things. There was a 20-year study called the Cardia study in young adults that looked at almost 4,000 patients over 20 years. And they just saw like how much magnesium they were taking and they broke them up into quartiles. Those in the fourth quartile taking more magnesium, which is really cool because, they looked at 17 years and 20 years for their sleep, which is a really long time. And basically it was self-reported and they just asked during the past month, how would you rate your sleep quality overall? And those taking more magnesium regularly reported better sleep quality, actually slept more than 7 hours and had less depression, which is sort of pretty cool, thinking about how magnesium may be supporting your sleep. A 5-year study took a look at dietary magnesium intake, so really just magnesium from the food. This study was done in China, and it was associated with reducing the likelihood of daytime falling asleep, which is interesting. They didn't report specifically sleep quality. They were looking at how did someone feel the next day if they were eating more sources of magnesium. And independent of short sleep time, the women, as opposed to the men who are taking magnesium from dietary sources, did feel less sleepy. So, which is really, really cool. And the researchers thought this may be explained by, maybe magnesium help improve the sleep quality by the whole issue with, helping with melatonin and then lowering cortisol levels. So very interesting. Magnesium also has been shown to reduce depression symptoms in a randomized controlled trial. And the thought that it may play a role with serotonin. We'll see. But it could also be that cortisol effect. We don't always know the specific pathways. Another researcher says, well, it does show some benefits. It's pretty cheap. Side effects are pretty minimal. It doesn't hurt to try. But like I said, always talk to a healthcare professional. Make sure it doesn't interact with any other medications that you're taking because there are some side effects from it. In elderly people, there was a trial that showed double-blind placebo control. It did improve time to fall asleep by like 16 minutes. So if you think 16 minutes is helpful, then 60 minutes it could be helpful depending on how long it's taking to fall asleep. If it's taking you an hour and you shave off 16 minutes, that may be really helpful. But again, when I take a look at sleep, I think sleep as really holistically. And sometimes we just try to chop it up and like, okay, I'm deficient magnesium and this is going to help solve all my problems. It's only one piece of the pie. So something to be considered. And then talking about different formulations. So there's a lot of different formulations, like the magnesium salt to magnesium amino acids, just how magnesium is coming to our body. And I was actually surprised by this information because a lot of people online now, social media, maybe pop culture, pop news, talk about magnesium glycinate, magnesium threonate. I've even talked about those things because supposedly it crosses the blood-brain barrier better. But when you take a look at the research studies, I didn't see anything for magnesium glycinate in sleep. I didn't see anything for magnesium threonate in sleep. Not to say that they aren't helpful, but there's just no information for me to discuss from a research standpoint. The research did include things like magnesium oxide and magnesium chloride, which, depending on the population, may have been beneficial for sleep. But yeah, so keep that in mind. One of the biggest things that we worry about with magnesium, though, is if you are a little bit more on the constipated side, it can be helpful because it can cause diarrhea. But if you already have a little bit loose stools, that's why magnesium glycinate and threonate may be a little bit better because it's supposed to be less diarrheagenic. So interesting fact to note, but I didn't see any studies, at least to date, from PubMed that showed magnesium glycinate or magnesium threonate was better than magnesium oxide or citrate specifically for sleep. Yeah. So yeah, that's the magnesium sort of in a nutshell. It can potentially help by promoting relaxation, maybe help with lowering cortisol, improving melatonin, but it's not sort of the silver bullet when it comes to sleep. Oftentimes, what I see in my medical sleep practice, why women have a hard time either falling asleep or staying asleep, are ruminating thoughts, stress, maybe anxiety, hot flashes, untreated obstructive sleep apnea. If you have restless legs, it actually can help with that. So that may be something to consider, which women can have more of. There's a video about restless leg syndrome that you can watch over here on my channel as well. But remember, it's the piece of the pie. If you have difficulty sleeping, poor sleep quality, we got to figure out why. If magnesium can help, then good. But there's typically more things beyond that. And then another takeaway is that more isn't always better. So sleep hygiene, I don't always often talk about sleep hygiene on this channel because I'd say a lot of times the people who come to me are really good about their sleep hygiene, making sure that they're exercising, avoiding caffeine and alcohol. Those things can be beneficial. I think a lot of it is unable to control our busy minds, maybe some pain or discomfort that happens as we get older, untreated sleep apnea, and then other health issues. The medications that your doctor puts you on can also disrupt your sleep. Waking up to urinate can be really bothersome. And guess what? Magnesium isn't going to necessarily help with that. So hope you found this video helpful, learning a little bit more about magnesium. If you have any questions, go ahead and put it in the comments below. If you love learning about women's sleep health and whole living, please subscribe to our newsletter. I'll put the link below as well. Until next time, ladies, sleep well. Thanks for stopping by.